You know, when you have a favorite song and you are playing it through a set of blown speakers?
Oh, yeah. The worst.
Right. You want to feel the music. You want the full immersive experience, so you just keep turning up the volume. But more volume doesn't actually fix a blown speaker.
No, it just makes the distortion louder.
Exactly. Because the problem isn't the volume. The problem is the wiring, right? The physical hardware is frayed.
And, for decades, when women have gone to their doctors complaining that their own physical hardware isn't responding, that intimacy has become numb or even severely painful, the medical advice has essentially been to just turn up the volume.
Just try a lubricant.
Right. Try a lubricant, have a glass of wine, just relax.
Ah.
The focus has always been on masking the symptom, not, actually repairing the underlying tissue.
Well, today we are taking a deep dive into a highly talked about, intensely debated treatment that claims to actually fix that wiring.
We really are.
We are asking one core question today for you. Can the O-shot actually improve physical sensitivity? And I mean, we have gathered a massive stack of sources for you today to figure this out.
A really fascinating stack, too.
Totally. We're looking at rigorous scoping reviews from medical journals like MDPI. We are analyzing official statements from the British Association of Plastic, Reconstructive, and Aesthetic Surgeons. And we are putting all of that right up against the glossy, direct marketing materials from various medical spas and clinics.
It is such a jarring cross-section of data, honestly. I mean, you have these high-level clinical trials sitting right next to aggressive cosmetic advertising.
Yeah, which is exactly why our mission for you today is to cut through all of that med spa marketing hype, strip away the dense medical jargon, and find out what is actually happening at the cellular level.
Because at its core, this is a profound exploration of how the human body can be coaxed into healing itself.
But before we can determine if it works for sensitivity, we really have to understand the underlying mechanism. I mean, we have to know what is actually going into the body.
Right. And the entire procedure centers around something called platelet-rich plasma, or PRP.
PRP, right?
And it is crucial to establish right up front that this is not a synthetic drug.
Oh, right.
Yeah, this is not some pharmaceutical compound formulated in a lab and introduced into your system. It starts entirely with your own biology.
Which is wild.
It really is.
Yeah.
The process begins with a simple blood draw, literally identical to what you would experience in a routine annual physical.
So they take that small vial of your blood and they place it into a centrifuge.
Exactly.
And that machine spins the blood at incredibly high speeds to separate its components based on their weight and density, right?
Right. So the heavier red and white blood cells are basically forced to the bottom. And what is left at the top is this highly concentrated, very dense serum of plasma and platelets.
Which is what clinics love to market as liquid gold.
Liquid gold, yes.
Because it literally takes on this rich, translucent yellow hue.
It does. But, the color's interesting, but the real magic is actually in the platelets themselves.
Tell me about the platelets.
Well, when platelets are just floating normally through your bloodstream, they look like smooth, microscopic discs.
Okay.
They are essentially dormant, but the centrifuge process subjects them to immense gravitational force, and that actually mimics the stress of a physical injury.
Oh, wow. So it tricks them.
Exactly.
Yeah.
That simulated trauma tricks the platelets into an activated state. They undergo this radical physical transformation where they sprout these microscopic octopus-like tentacles
Octopus tentacles.
in your blood.
I know, it sounds like sci-fi. But in a natural injury, those tentacles allow them to physically grab onto damaged tissue walls to stop bleeding and initiate repair.
Okay, let's unpack this. If I can use an analogy here, it is like your body has an elite, highly specialized construction crew just floating around on standby in your veins.
I like that.
Right. And when a doctor injects that activated PRP, they are taking that entire elite crew, dropping them directly onto a specific targeted work site and handing them the exact blueprints to rebuild the local infrastructure from the ground up. That is actually a highly accurate way to visualize it.
Really?
Yeah, because when those tentacled platelets arrive at the injection site, they release a massive payload of bioactive molecules called growth factors.
Which are what exactly?
Well, in the medical data, you will see these listed as VEGF, PDGF, and TGF-beta, alongside various signaling proteins called cytokines.
Okay, I buy the construction crew analogy for a torn muscle or damaged joint, but the vulva and the clitoris are complex neurological zones.
Right, highly complex.
So how does building generic tissue actually translate to feeling more pleasure? I see these acronyms, VEGF, PDGF, But what are they actually building that changes physical sensation?
Well, let's break down those acronyms because they really hold the answer to your question.
Okay.
So VEGF stands for vascular endothelial growth factor. Think of VEGF as a chemical flare being shot up in the body that yells, "We need new blood vessels over here immediately."
Oh, I see.
Yeah, this triggers a process called angiogenesis, which is the literal sprouting of brand new healthy blood vessels. And more blood vessels mean a drastic increase in localized blood flow.
And blood flow is the absolute engine of arousal and natural lubrication.
Exactly. And beyond the blood vessels, you have PDGF, or platelet-derived growth factor.
What does that one do?
This specific molecule stimulates local stem cell activity and forces the replication of fibroblasts. And fibroblasts are the cells responsible for creating new collagen and elastin.
Okay, so building the actual structure.
Right. So to answer your question about how this translates to pleasure, nerve endings cannot function if they're buried in atrophied, poorly oxygenated tissue.
Ah, that makes sense.
By injecting PRP, you are fundamentally rebuilding the microvascular network. You are providing the physical infrastructure, the blood supply, and the healthy connective tissue required for those dormant nerve endings to fire optimally again.
Here's where it gets really interesting, though, because, does this actually work outside of a petri dish?
That is the big question.
Right. The cellular theory sounds miraculous, but theory doesn't always survive contact with reality. Women are going into these clinics suffering from a whole range of very real, very distressing issues.
They are. And to understand the clinical reality, we have to look at the application. The procedure itself is relatively fast.
Yeah.
A topical numbing cream is applied, and then the concentrated PRP is injected into specific targeted points.
Yeah.
Primarily, this is around the clitoral glands and the anterior vaginal wall.
Which is the area commonly associated with the G-spot.
Exactly.
And the sources show this is being used to target 5 major, distinctly different problems.
Let's list those out.
We are looking at arousal disorder, hypoactive sexual desire disorder, which is chronically low libido orgasmic disorder, genital mismatch, and dyspareunia, which is the medical term for severe pain during sex.
And the clinical scoping reviews, particularly the comprehensive data published in the journal MDPI, offer some incredibly compelling evidence here.
So it actually works.
Well, we are not just looking at anecdotal success stories here. Medical researchers are tracking outcomes using standardized metrics, and the gold standard in these studies is the Female Sexual Function Index, or FSFI.
Okay, let's hover on that for a second, because the FSFI isn't just some simple, do you feel better, yes or no questionnaire.
Not at all.
It is a rigorous 19-item diagnostic tool that measures 6 different domains of sexual function. So it measures desire, arousal, lubrication, orgasm, satisfaction, and pain.
Right.
And it scores a patient from 2 to 36. And basically, any score under 26.5 is clinically classified as sexual dysfunction.
That's the baseline.
Yeah.
And in a landmark prospective study by Sugan and colleagues, they tracked 52 women suffering from severe sexual dysfunction.
Okay.
Before the PRP injections, the average FSFI score for these women was a 13.6.
Wow, that is low.
It is.
Yeah.
That indicates profound distress and lack of function across the board. But 6 months after the PRP treatment, that average score jumped to 27.9.
Meaning a massive portion of those women cross the threshold from clinical dysfunction entirely back into the realm of normal, healthy sexual function.
Exactly. And we see that data corroborated by randomized controlled trials, too. A study by Purgidis isolated the metrics and showed statistically significant, measurable improvements, specifically in the domains of orgasm frequency and natural lubrication.
Okay, wait. Here's where I have to play devil's advocate.
Go for it.
This is an elective, out-of-pocket procedure. It is rarely covered by insurance. A patient is looking at paying anywhere from $1,000 to $2,000 or, around 1,300 pounds for a single session.
It is incredibly expensive.
And when you look at the marketing from these medical spas, they are blasting claims of 75% to 94% success rates. When a patient pays $2,000 out of pocket for an intimate procedure, aren't we just looking at a massive, incredibly expensive placebo effect?
It is a fair point.
The brain is powerful. If you pay that much money, you really want it to work.
Your skepticism is entirely justified, especially considering how susceptible sexual medicine in general is to the placebo effect.
Yeah.
However, if we connect this to the bigger picture, the data proves this goes far beyond just a psychological boost.
How do we know that, though?
We know this because the studies incorporate objective biological markers that a patient absolutely cannot consciously control or fake.
What kind of objective markers? How do they prove the tissue is actually changing?
The strongest evidence actually comes from how PRP is used to treat severe, physically verifiable conditions.
Like what?
For example, there's an autoimmune skin condition called lichen sclerosis. It causes the skin of the vulva to become incredibly thin, leading to painful tearing, bleeding, and severe scarring.
That sounds awful.
It is, and for decades, the only treatment has been heavy topical steroids. But researchers like Tedesco and colleagues didn't just ask these patients how they felt after PRP. They used thermography.
Dermat.
Yeah. They utilized infrared cameras to measure the actual heat radiating from the tissue, which objectively proves a massive increase in localized blood flow and reduced inflammation.
The temperature of the tissue literally changed.
Literally changed. Furthermore, in patients suffering from recurrent urinary tract infections, researchers took actual physical biopsies of the vaginal wall before and after PRP treatment.
Real tissue samples.
Yes. Under a microscope, those biopsies showed a dramatic increase in cellular proliferation and physical repair markers. The architecture of the tissue was measurably thicker and healthier.
That is staggering. And, the data also showed this working on conditions that I wouldn't have even thought were treatable with an injection.
A prime example of that is the cohort study by Dardier and colleagues.
Right.
They focused on women who had undergone female genital mutilation or cutting, known as FGMC.
Which is such a severe trauma.
It is. This practice leaves behind dense avascular scar tissue where nerves are trapped, severed, and unable to function, resulting in total numbness or chronic pain. The researchers found that injecting PRP directly into these reconstructed areas actually helped remodel the dense collagen of the scar tissue. It softened the scars and allowed for revascularization, which significantly improved physical sensitivity and sexual response.
To realize the body can soften and reverse severe scar tissue using its own plasma is incredible.
It really changes the paradigm.
And the sources also highlight its use for stress urinary incontinence, or SUI. That is the everyday leaking that happens when someone coughs, sneezes, or jumps.
Right.
The PRP growth factors physically strengthen the depleted connective tissues and the support structures around the urethra, giving patients their physical control back.
Which just goes to show we are seeing a treatment that addresses the physical root cause of the dysfunction.
Yeah.
It is not masking a symptom with a temporary lubricant, and it is not relying on a systemic hormone cream that affects the entire body.
Yeah.
It is local structural repair.
So what does this all mean? If biopsies are proving physical tissue change, and thermography is proving increased blood flow, and women are finally getting relief from severe conditions like lichen sclerosis, why is this still treated like a fringe med spa novelty instead of standard first-line gynecology?
That is the million-dollar question.
I mean, if it is a medical breakthrough, why isn't the protocol standardized across every hospital in the world?
The answer lies in the massive regulatory loopholes surrounding blood biologics.
Loopholes?
Yeah. When you read through the scoping reviews, the most glaring issue is the heterogeneity of the data. The inconsistency from clinic to clinic is just staggering.
But why is there so much inconsistency? If a doctor is doing an O shot, shouldn't there be a universal medical manual for how to do it?
You would think so.
Yeah.
But you have to understand how the FDA and similar bodies worldwide regulate medicine.
Okay.
The FDA regulates pharmaceutical drugs. They approve the physical centrifuge machine used to spin the blood. But once that blood is spun, the act of injecting your own biological material back into your own body is considered the practice of medicine. And that falls into a regulatory gray area.
Oh, I see.
Because you cannot patent a human being's own blood.
Yeah.
Because it is autologous, meaning it comes from the patient, the safety profile is incredibly high. The risk of an allergic reaction or immune rejection is virtually zero.
So because it is inherently safe, clinics are essentially left to their own devices to figure out the best way to do it.
Exactly. Which leads to wild variations in clinical practice. The data shows some doctors reporting great results using just 2 milliliters of PRP. Other studies have doctors extracting and injecting up to 10 milliliters.
That is a huge difference.
It is. Med spas are purchasing completely different brands of centrifuges. Some spin the blood for 5 minutes, others for 15. They spin at different gravitational forces, resulting in entirely different concentrations of platelets.
Wow.
The depth of the needle, the frequency of the injections, none of it is standardized.
It is like having a conceptual recipe for an award-winning cake, but every single baker across the country is using completely different amounts of flour, totally different brands of sugar, baking it at wildly different temperatures, and then they all put a sign in the window claiming they are selling the exact same cake.
That is spot on.
How is a patient supposed to navigate a landscape where the medical data is this fragmented?
This raises an important question, and that fragmentation is exactly what drew the attention of the British Association of Plastic, Reconstructive, and Aesthetic Surgeons, or BABRAS.
Yeah, their statement was intense.
They released a very firm statement, specifically addressing the rapid rise of female genital cosmetic procedures, including treatments marketed under the trademarked O-Shot umbrella.
They did not hold back on their criticism of the industry surrounding these procedures.
Not at all. BABRAS is deeply concerned about what they call the subtle coercion from the cosmetic industry. Yes. Their stance is that the lack of large-scale, standardized, randomized controlled trials creates an environment where profit-driven clinics can exploit vulnerable patients. They argue the cosmetic industry is aiming to profit from women's apprehensions and manufactured insecurities about their bodies.
They are pointing out the massive difference between a woman seeking out a PRP injection to heal the severe bleeding tears of lichen sclerosis and a woman who is perfectly healthy but has been convinced by a predatory Instagram ad that she needs a $2,000 injection to be anatomically normal.
And that is the crux of the ethical debate. BAPRES strongly recommends that clinics offer psychological counseling for body image distress before a patient undergoes any surgical or cosmetic intervention in this area.
They want safeguards.
Exactly. They want a safeguard in place to ensure that normal anatomical variations are not being pathologized by med spa marketing campaigns.
We are looking at this incredibly messy intersection here. On one side, you have genuine, verifiable regenerative medicine. The science of platelet-rich plasma is real. The tissue regeneration seen in biopsies is real.
Very real.
But on the other side, the environment in which it is being sold to women is largely unregulated, unstandardized, and heavily driven by profit margins.
That is the reality. The clinical data tells us that the O-Shot utilizes the body's own regenerative abilities to physically repair tissue. It shows genuine promise in improving sensitivity, restoring natural lubrication, and treating devastating conditions that have historically been ignored.
Right.
But the lack of standardization means a patient's results will vary wildly depending entirely on the skill of the provider and the specific equipment they use.
Which makes it incredibly difficult for you, the listener, to figure out your next steps if you are actually suffering from these conditions. It highlights the absolute necessity of seeking out highly qualified medical professionals, doctors who understand the underlying cellular biology, and not just walking into whichever med spa has the flashiest billboard or the biggest social media presence.
The science of regenerative medicine is simply moving faster than the regulatory bodies can keep up with.
Today, we have unpacked the cellular biology of liquid gold. We have looked at the undeniable clinical triumphs proving tissue repair, and we have navigated the unregulated wild west of the cosmetic industry.
We covered a lot of ground.
We really did. It represents a monumental shift in women's health. We are moving away from an era where women were told to just suffer in silence or rely solely on systemic hormones, and we are stepping into a world where the body can be instructed to rebuild itself. But there's one final thought we want to leave you with today to ponder on your own.
It is a thought that really reframes this entire debate.
What if the real breakthrough of treatments like the O-Shot isn't just the cellular tissue repair? What if the true milestone here is the fact that this treatment is forcing the broader medical community and society at large to finally treat female sexual pleasure and pain as legitimate physical medical conditions?
That is so important.
Conditions that deserve serious, rigorous scientific funding and standardized care, rather than just brushing them off as psychological issues or relegating them to the realm of luxury med spa novelties. If the speakers are blown, you don't just keep turning up the volume. It is time we finally acknowledge that the wiring deserves to be fixed.